First, let's talk a little bit about terms and types of fees, because there are different types of fees that patients can be charged, and they really aren't all identical. And there's actually been quite a bit of debate as to whether these fees are worth it, whether there is any regulatory or reputational risk when it comes to these. Now, I personally believe that, looking at your payer contracts, working with, your own team, that it is absolutely appropriate to do these. But it just depends on what you're calling them, what services are provided, and making sure that from a payer contract perspective, you are allowed to do that. So let's first talk about the two types of fees that we're going to discuss today. So the first is an administrative fee for services. So this typical administrative fee model basically uses a patient's insurance for covered items, but charges a fee for uncovered administrative or operational tasks. Services covered by this fee include consulting patients over the phone, faxing documents to employers, calling in prescription refills, completing forms. This fee is usually pretty small, where it ranges from $20 to $150 per patient annually. And fees can be charged either on an annual, or some we see do it on like a per item basis. So that's one type of fee. The second type of fee is what's called a concierge medicine fee. Now, this differs than in the administrative fee because it is generally just a premium service. So healthcare organizations can charge significantly more for this type of access to the physician or to the practice. And so this fee is also usually charged in addition to insurance and ranges from a few $100s a year to tens of thousands of dollars a year, depending on how comprehensive the coverage is. Now, concierge medicine often involves, things like same-day appointment scheduling, yearly preventative checkups, maybe your personal, physician's phone number. You can text them whenever, 24/7 access, those sort of things. And again, I'm just explaining kind of some things that we see in practices. So this is an optional thing where oftentimes physicians will have this as an option for patients to subscribe to, where they get a different level of service if they're in that concierge medicine group of patients. And practices may decide, well, I just want to have a subset of patients that I do that with. And again, they're still charging their insurance for the visits and labs and whatever else. You just kind of have this above access to the practice or to the healthcare team.